On this Thursday night, shattering records for the wrong reasons. New COVID cases hit all-time highs in several provinces as hospitals brace for an Omicron onslaught.
A lot of people will get exposed.
But emerging evidence suggests that highly contagious variant may be much less severe. Quarantine questions.
I'm a little worried about shortening isolation times.
Why some health workers exposed to COVID may still have to report for duty. The verdict is in. A jury reveals the fate of a white police officer who killed a black driver, Daunte Wright. And dubious distinction, the high-profile people who made Santa's naughty list. And we'll tell you which Canadian just dethroned the Queen from the nice list.
Global National with Donna Friesen. Reporting tonight, Jeff Semple.
Good evening and thank you for joining us. We begin tonight with good news and bad news in the fight against COVID-19. The good news, the strongest indication yet that Omicron may be a much milder variant of the virus. A major analysis by the UK Health Security Agency found people with Omicron are up to 70% less likely to end up in hospital compared with previous variants. Similar studies from South Africa, Scotland, and Denmark have all pointed to less severe illness. The bad news, Omicron is spreading so fast that the sheer number of infections could still lead to hospitals becoming overwhelmed. Today, more than 20,000 new cases were confirmed in Canada. BC just smashed its new daily case record for the third day in a row. In Atlantic Canada, Nova Scotia, New Brunswick, and PEI all set records. And the two most populous provinces, Ontario and Quebec, are also reporting all-time highs. Officials caution those are likely vast undercounts given the backlog in testing. Quebec remains Canada's hotspot with nearly 9,400 new cases. That province is hoping restrictions on gatherings and businesses will help to turn things around. But as Mike Armstrong explains, it's also planning for the worst.
There are two things Quebecers need right now to get a COVID test: a Medicare card and patience. Testing facilities are operating at capacity, about 54,000 tests a day. Critics say the official COVID numbers may be sky high, but they may also be artificially low.
They should be doing twice as much, and we don't have the staff for that. We're not going to stop vaccination to do more tests, but you have to remember that the 9,000 is probably a lot more in real life.
One of the factors that may have made Quebec once again the country's hotspot is its booster numbers. It's in 8th place nationally. In terms of first and second doses, it's middle of the road. Only 15% of the population is unvaccinated. That said, they are very overrepresented in hospital beds.
If you actually look at Montreal's data, right? Montreal's data shows that if you are unvaccinated, you're actually 3/4 of the hospitalizations.
Now, the healthcare system in Quebec is preparing for trouble. Hospitalizations are rising. In Montreal, more beds are being dedicated to COVID patients, surgeries are being cut, and resources are being moved around. Complicating everything are doctors and nurses catching COVID.
The staff are getting infected. Every single day this week, it's one or two doctors here and there.
One positive appears to be how sick people are getting. Doctors say it's still early, but anecdotally, it feels as though this wave, primarily Omicron, is easier.
They're getting sick, they're making it to the ICU, but they seem to also turn around quicker.
Since the beginning of the pandemic, Quebec has had some of the tightest rules in North America. That continues. Essential businesses have been ordered to close. There are limits on seating and hours at restaurants. And for family gatherings over Christmas, it's allowing up to 10 people. But as of Boxing Day, the limit will be cut to 6. Despite all those measures, the province's optimistic models for the next month predict hospitalization numbers similar to the worst wave of 2021. The pessimistic models are worse. Mike Armstrong, Global News, Montreal.
And Omicron's rapid infection rate is forcing officials across the country to rethink self-isolation protocols. With the growing number of Canadians catching COVID, coupled with their close contacts, essential services and businesses are worried that they could be left short-staffed. Jamie Mauracher on the tough choices facing some hospitals.
Contact with a COVID case is no longer uncommon in Ontario, and it was unavoidable for professor and family physician Keena Bracken when her husband tested positive.
I was able to completely isolate from him and, wear my mask if we have to.
She hasn't contracted the virus, and while she says she's been able to keep up with her patients and residents, there's concern among her community Omicron will cause chaos.
If you have all of a sudden all your healthcare workers off because there was potentially an exposure, then who's going to work? Who's going to take care of COVID patients and non-COVID patients?
With more mild breakthrough cases of the highly transmissible variant expected in the coming weeks, Quebec's largest healthcare union says the government is considering an aggressive plan. Allow asymptomatic COVID-19 positive hospital workers to stay on the job, assigned to already infected patients. In the U.S., Biden's chief medical advisor, Dr. Anthony Fauci, hinted it is also considering reevaluating isolation guidelines for healthcare staff. While back at home in Ontario, it will now allow nurses and doctors who are exposed to someone with COVID-19 to continue work as long as they test negative.
Instead of shutting everything down, we're being a lot more pragmatic, saying it's a different world. We have high rates of vaccination. We're not seeing an influx of hospitalizations. And this is a way of letting people move on with their lives.
In England, self-isolation rules have been shortened for everyone from 10 to 7 days as long as they test negative twice in a row. The Smart family from Toronto is a week into their Christmas quarantine after a close contact last Thursday. Since, both Amy and Colin have tested positive.
I'm a little worried about shortening isolation times when testing is so tough to come by.
Dr. Bracken agrees it's another hurdle provinces will have to overcome.
Things have changed over the course of time, and it's really hard to adapt to change as rapidly as we need to.
Fortunately, in the era of Omicron, time is a luxury officials just don't have. Jamie Mauracher, Global News, Toronto.
The U.S. is also seeing record COVID-19 cases driven by Omicron at a time when many hospitals there were already struggling to keep up with the Delta variant. An average of 168,000 cases are now being reported every day. That's nearly 40% more than just a couple of weeks ago. Hospitalizations are also up by 11%. As Jackson Proskow reports, the surge has sparked overwhelming demand for rapid tests and new treatments.
Demand for COVID testing has outstripped supply. Hard to find rapid tests are now the must-have item for the holidays as millions of Americans weigh whether they can gather safely.
We've both possibly been exposed to people in the past couple of days who have COVID, and the rapid tests, the home tests, are impossible to find.
The testing crunch comes as cities and states shatter records for daily case counts. In Washington, D.C., cases are up nearly 400% in a week.
There's a lot we don't know.
In an interview with ABC News, President Joe Biden suggested there was no way to have prepared.
How did you get it wrong? How did we get it wrong? Nobody saw it coming. Nobody in the whole world. Who saw it coming?
Already strained hospitals are now bracing for a potential Omicron-fueled surge that could also sideline doctors and nurses.
It's really the unknown. We are in a perfect storm.
It's not clear how the new variant will impact the large number of unvaccinated Americans. Former President Donald Trump is appealing to his often hesitant supporters to reconsider.
The ones that get very sick and go to the hospital are the ones that don't take the vaccine.
There is some new hope for those who might become severely ill. The FDA approved a second at-home COVID treatment. The antiviral pill made by Merck is less effective than a similar treatment from Pfizer. New York. It all comes too late to stave off major holiday disruptions. New York will now scale back New Year's Eve in Times Square. Mandatory masks and fewer people. Ending the year as it began with COVID driving caution. Jackson Proskow, Global News, Washington.
In China, a city of 13 million people is now under snap lockdown after an outbreak of COVID-19. All residents of the northern city of Xi'an are barred from leaving their homes except to buy essential items. No one is allowed in or out of the city unless given permission. So far, 127 cases have been detected. South Korea, meanwhile, has just set a new record for daily COVID-19 deaths. Today, 109 deaths were reported, and more than 1,000 people were in hospital with serious symptoms. South Korea has been grappling with a major surge in cases after relaxing restrictions in November. Tough measures have since been reimposed. In the U.S., a police officer who said she mistook her gun for a taser has just been found guilty in the shooting death of Daunte Wright. A jury has convicted 49-year-old Kim Potter on 2 counts of manslaughter. She shot and killed Wright, a 20-year-old black man, during a traffic stop in Minneapolis in April. Potter said at the time she thought she had grabbed her taser. Potter now faces a maximum sentence of 15 years behind bars. Libya's election suspension. Coming up, why the war-torn country's first presidential vote has been postponed amid fears of fighting. In Libya, voters were supposed to go to the polls tomorrow in a much-anticipated presidential election. But after months of disputes over the rules and candidates, that vote has been delayed. One of those running is a son of former Libyan leader Muammar Gaddafi. The dictator was killed in an uprising a decade ago, and the country has been in turmoil ever since. As Redmond Shannon reports, there are now fears the looming election could trigger more bloodshed.
The 2011 capture and killing of Muammar Gaddafi was meant to signal a new beginning for Libya after 42 years of his authoritarian rule. But within 3 years, the oil-rich nation descended into civil war, 2 parallel governments and smaller militias fighting for control. One side loosely backed by the UN with support from Turkey and Qatar, the other led by Army Commander Khalifa Haftar, supported by Egypt and Russia.
We have lost a lot of hope. You cannot imagine these 11 years, besides no electricity, no water, but when you see people actually being killed, houses being burned down, war is not an easy thing.
Some violence has continued since the 2020 truce brokered by Turkey and Russia. Since then, an interim government has chaotically shepherded Libya toward this presidential vote.
The elections are ripe, not for democracy or democratic transition, but essentially a return to authoritarianism. And the reasons for that are the number of electoral, legal and political disputes on the ground.
Firstly, interim Prime Minister and former Gaddafi ally Abdul Hamid Dbeibeh promised he wouldn't run in the election, but he changed his mind. He's widely reported to have studied at the University of Toronto, but U of T has no record of anyone of his name graduating. Secondly, in recent months, courts sentenced Haftar to death and excluded him from running for president, only for Haftar to be allowed to enter the race on appeal. And a third leading candidate, the son of Muammar Gaddafi, Saif al-Islam, was also barred from entering, but he had that overturned too. Speaking with the New York Times this year, he framed himself as a bringer of stability, but said little on policy. Saif had been imprisoned for war crimes, and just this month the International Criminal Court reminded the world that he is wanted for alleged crimes against humanity.
And he is certainly an ideological lightning rod in Libya. He really does cut right down the dividing line between those that want to transition towards a democratic and an equitable Libya, and those that just want to see it run by, certain tribes and certain members of Libya's communities that may ride in first class in an authoritarian boat whilst leaving everyone else in coach.
There are dozens of candidates, including others who've spent time in Canada. Analysts say as long as foreign powers continue to have a military influence in Libya, the country will remain divided and ultimately lawless.
What's very important, that we have to take back this legitimacy that we have given to these militias, to these criminals.
Libya's outgoing United Nations mediator thinks the country needs a vote as soon as possible, as the UN Security Council remains divided on its strategy for this troubled North African nation. Redmond Shannon, Global News, London.
Does plexiglass provide proper protection from COVID? And how can you safely socialize with unvaccinated friends and family over the holidays? The experts answer your COVID questions after the break. We've heard growing calls from health officials in recent days for people to upgrade their masks to protect against Omicron. But what exactly makes the mask the right fit? To answer that question and others we've received from our viewers over the past few days, we are joined now by infectious diseases physician Dr. Isaac Bogosh and epidemiologist Patrick Saunders Hastings. Doctors, thank you both so much for joining us to tackle some of these questions. So Isaac Bogosh, first over to you. For those of us who put masks on our Christmas list this year, Fred wants to know, is mask quality more important with Omicron, and what's acceptable, and when should a mask be discarded or washed? What do you think?
Yeah, a couple of points here. A higher quality mask certainly is more important, especially with Omicron, where we have very little wiggle room, as this is a very transmissible variant. Higher quality means something better than a single layered cloth mask. You might hear words like N95 or KN95. It's thicker, they've got less pores in them, and the key thing here is it's got a tighter fit around the nose and around the mouth, and that's really it. A good tight fit around the face and a higher caliber mask. N95, KN95, sometimes you hear surgical masks as well. And again, these N95s and KN95s have usually a much tighter fit than the surgical masks do.
Yeah, very good to know. Dr. Saunders Hastings, over to you for the next related question. This one comes from Lisa, who says that she works in an office with several people sitting next to each other, not wearing masks, but there are plexiglass barriers in between them. Does plexiglass help protect against Omicron?
It does help protect. I think, like masks, plexiglass can be a tool in a tool set of preventing transmission. But I think, like masks, they are not foolproof and they are not 100% effective. And so I think we're often better served considering plexiglass as part of a broader suite of transmission prevention protocols, including masks. And so I think when we're talking about office settings, depending on the crowded nature, the ventilation, other protocols in place, plexiglass may or may not be sufficient, but it certainly doesn't hurt and it can help to prevent transmission.
Okay. Dr. Bogosh, back over to you for this next question. It comes from Judy, an interesting one. She says, if someone has COVID but doesn't know it, perhaps they're asymptomatic, and then they go to get a vaccine, how will that affect them? Will the vaccine work?
Yeah, this is actually a remarkably common issue. Sometimes people get the vaccine in close proximity to a COVID-19 infection. They didn't know they were infected, or they might have been incubating the virus at the time they got the vaccine. In general, we're not seeing any significant issues with this whatsoever. In a perfect world, we would usually vaccinate someone after they've recovered from their infection. But if they do get a vaccine around the time of infection, we haven't seen any issues with that.
Yeah, interesting. Dr. Saunders Hastings, speaking of vaccines, and this is a timely question, of course, comes from Carol, who says that she has 3 members of their small family group that are not vaccinated, and she's wondering how to have them over in the household for socializing and holiday dinner, how to do it safely.
Right. So certainly vaccines are a safe and effective way of preventing transmission, and we'd absolutely encourage everyone to get their vaccines, as well as to consider keeping your distance from unvaccinated individuals. With that said, if you are not going to adhere to that guidance, I think, again, we can consider vaccines as part of a broader suite of transmission prevention tools. And so for those that are unvaccinated who will be seeing others, you could consider isolating before that gathering. You could do rapid testing in advance of that gathering. You could wear a mask. You could distance at that gathering. So I think there's a lot of non-pharmaceutical interventions that can still help reduce that risk, though it will be higher by gathering with unvaccinated individuals relative to vaccinated ones.
Yeah, helpful information for a lot of families, certainly over the next few days. Patrick Saunders Hastings, Dr. Isaac Bogosh, thank you both so much for taking the time. Really appreciate it.
Thank you.
My pleasure.
And we'll be putting your questions about Omicron to the experts again tomorrow. So please send us yours to yourquestions@globalnews.ca. Next, naughty or nice? Who's on the wrong side of Canada's Christmas list? Some sad news out of the U.S. tonight. Journalist and author Joan Didion has died. In the 1960s, Didion emerged as a distinct voice in U.S. literature. Her work includes The Year of Magical Thinking and The White Album. In 2012, she received a National Humanities Medal from then-President Barack Obama and was praised for devoting her life to noticing things other people strive not to see. Didion was 87. Well, if you have kids, you've probably spoken to them about Santa's naughty list. If nothing else, it's a great way to get them to do chores in December. But there's another list out today that asked ordinary Canadians to rank high-profile people as naughty or nice. And as Mike Drolet tells us, you might be surprised who made the list.
Christmas, a time filled with laughter and joy, family get-togethers, and the shame of being on the wrong side of Santa's naughty or nice list.
Well, here it is. And it's magic.
Not to be outdone by Santa, our friends at Ipsos came up with their own list, or rather, Canada's list. This year, it's topped by a Russian. So what gives Canada? Why does Vladimir Putin top your naughty list?
Maybe it's because of there are hockey rivals, maybe because of the Cold War, maybe because of whatever, but the leader of Russia is not seen as a particularly positive person by Canadians.
Oddly enough, Justin Trudeau comes in a close second to Putin, which could be seen as either an affront to Trudeau or Putin. I guess it shouldn't be that surprising to see so many politicians like Ontario Premier Doug Ford make the list in these polarizing times, or billionaires for that matter, who would have been celebrated a decade ago for their ingenuity, but now Jeff Bezos and Mark Zuckerberg are seen as evil tech geniuses. But enough with who's naughty in the eyes of Canadians.
Open the door for her, Kevin.
Let's talk about nice. And is it any surprise healthcare workers top the list? And sure, Dr. Theresa Tam, Greta Thunberg, Sidney Crosby, and Dr. Anthony Fauci all have varying degrees of nice in them. And Justin Bieber is equally naughty and nice in our eyes, which makes sense as well. But there's a new addition who has done the unthinkable and knocked the Queen off her perch.
You know, I've been doing this for many, many years, for perennially top the list, like the Queen does really well on this, but Ryan Reynolds even does better than the Queen.
Yeah, Canada loves Ryan Reynolds.
But Canada loves you back.
And why wouldn't we? He's funny, nice, and charitable. But if there's anything to learn from these lists, it's this. He should enjoy the throne for now. Who knows what next year will bring? Mike Drolet, Global News, Toronto.
Congratulations, Deadpool. That is Global National for this Thursday night. I'm Jeff Semple. Tonight's Your Canada is this very festive truck in Carstairs, Alberta. Please keep sending us your photos to viewers at globalnational.com. Thanks for watching. Hope to see you back here again tomorrow. Have a great night.